A silver lining of COVID, maybe. Our medical community has been able to achieve some pretty incredible feats of science. For example, the vaccine. Another, monoclonal antibodies. It's become vital in helping those that become sick with COVID to get better. Those antibodies are injected into someone battling COVID in the hopes that it keeps them from getting sicker. A recent problem, though, a majority of the monoclonal treatments available are not strongly effective against the Omicron variant. And like many other things, there's supply and demand issues. That reality puts Idaho and the rest of the country in a tough spot. So where do we go from here? Well, Joe Paris spoke with the director of a monoclonal clinic in Boise and Idaho's state epidemiologist about how Idaho is navigating through this.
Through the coronavirus pandemic, monoclonal antibody treatments have emerged as a popular technology to treat people in need. Monoclonal antibodies work by attaching to the COVID virus to prevent it from infecting cells. The treatment is most effective for a person who gets COVID or for a person who is immunocompromised and exposed to the virus. Getting monoclonal antibodies is highly popular right now. Just ask the Boise-based clinic, Direct COVID Care.
Yes, recent weeks it has been very busy.
Dr. Ryan Williams is the medical director for Direct COVID Care. Dr. Williams says after ramping up their operation in November, they're now seeing a lot of interest in monoclonal antibody treatments from eligible patients.
We're able to fit in roughly about 30 to 40 patients per day, usually just 3 days a week due to supply and staffing.
As Dr. Williams referenced, monoclonal antibody treatments are limited for now. Each state only gets a set allocation to treat eligible people. New research shows that only one of the 3 monoclonal treatments available in the U.S. is highly effective against the very contagious Omicron variant. That drug is called Sotramab. Now, 2 weeks ago, it appeared that Idaho would only be able to order Sotramab going forward, cutting down on the supply available to treat people. The reason being that the other 2 drugs available simply weren't as effective at this point. But now it appears the course is changing.
They've had a change of heart.
State epidemiologist Dr. Christine Hahn says providers in Idaho have reported pretty good results using the 2 treatments that are not as effective against Omicron. So for now, they want to be able to continue using those.
As long as we believe we still do have some areas of the state that might still be seeing Delta, and as long as providers are telling us that they are seeing benefit to their patients, and since we have no other alternative treatment for many of those patients, we felt that the most ethical thing to do was to continue to offer it to our providers.
Monoclonal antibody supplies remain limited, especially Sotramab. But for providers like Direct COVID Care, it allows them to try and help more people in need.
The treatment has the most bang for its buck with the sickest patients that qualify for the treatment. So if you have many risk factors that are associated with your underlying medical conditions and you have COVID, then the treatment will help you the most.
With that said, Hahn explains there is an important caveat that health and welfare is relying to providers.
We have recommended to them that they have a frank discussion with their patients, that if it is an Omicron, it is possible that that drug will not help them.
Dr. Williams says at his clinic, they've seen about 80% of patients treated overall have marked improvement at 48 hours post-treatment, even with recent changes in the variant. Before the Omicron variant, though, it was probably 85 to 90% improvement. Dr. Williams says the staff at Direct COVID Care has been incredible, as they too have worked long days treating as many people as possible.
It's been really rewarding for us and the staff to treat these patients, and then after 48 hours after we treat them, we give them a call, and the majority of patients feel a lot better within 48 hours. So it's been really rewarding. We're very grateful to have this clinic up and going.
So great. That's the good news. But as you said in your story there, Joe, they're only able to serve about 30 to 40 patients a day. Hospitals around the Boise area, like St. Alphonsus, sometimes get 20 to 30 new patients admitted to the hospital every day. So it doesn't quite add up. Supply is an issue. But with those extra 2 or those other 2 that maybe aren't as effective, how long are they going to be around and available?
It really depends on how the Omicron variant works over the next several weeks and months, because right now we do know those 2 drugs that are not Sotramab, they are effective against Delta and that Alpha strain of COVID. So the question here becomes, at what point does Omicron become the main strain by so much that we really don't see that much Delta anymore? And Brian, at that point, that's when we would probably see those other 2 drugs really phased out, because they really aren't as effective against Omicron, I should say. But as long as Delta variant really is sticking around, as you heard Dr. Hahn allude to, if there's pockets in Idaho with Delta, they're really hoping to still have access to those drugs.
All right, so yeah, at least to give people some options. All right, thank you very much, Joe.